Lymphatic filariasis, commonly referred to as Bigfoot in Guyana, is a vector-borne neglected infectious disease that is mainly hidden in the early stages and often acquired during childhood, leading to a lifetime of chronic disabilities. That's according to Paho WHO resident representative in Guyana, Dr. William Aducro.
I think the issue of lymphatic filariasis became a major one at the global level when it was realized that it reduced productivity, had economic impact. It had also stigma attached to that, as well as also the disability that, it produced. On the global scene, it was thought that a disease such as LF that can be prevented.
First, could you say more about filaria itself? Is it contagious? Is it hereditary? How is it contracted? And how could it be prevented?
It's not contagious as such. It is a tiny worm that is picked up by a mosquito. So the mosquito bites. Someone who has LF picks it up, from the body fluids, and then this microfilaria grows in the mosquito to an adult phase, bites another person. If we're able to prevent the mosquito from biting us, so that's one. So there's some issue of vector control, or we give the medication to actually kill the filaria worms.
He explained that Guyana is one of the 4 countries in the Americas which is yet to eliminate this disease, and more needs to be done in order to prevent its prevalence, ultimately leading to elimination of the disease.
I think we can do better than that. I think we need to move ourselves away from that list. And I must say that most of the countries that I just mentioned are ahead of us in the elimination. And therefore, it is time that we pick ourselves up and make sure that this time we ensure that the elimination takes place.
Guyana's aim was to eliminate this infectious disease by 2020, but according to Dr. Aducro, this goal may not be achieved.
We have not, and I don't think we are going to be able to meet the elimination target of 2020. But it doesn't stop us from coming up with a revitalized plan to make sure that we have elimination at some point in time.
This October, Paho WHO, in partnership with Guyana's Ministry of Public Health, will be carrying out its mass drug administration project throughout the country to provide tablets for citizens to prevent the transmission or contraction of lymphatic filariasis. Reporting for HGP Nightly News, I am Kristen Macklingam.